Hi, I'm Dr. Shivani Parikshak, and I'm a pediatrician with Franciscan Physician Network. I decided to become a pediatrician because I enjoyed going to my own pediatrician, Dr. Smith, growing up, and I always knew I wanted to work with kids. So I kind of decided I wanted to go into pediatrics very early from when I was in elementary school. The role of a pediatrician is to be involved in a child from the time that they're born until the time that they turn 18. And that goes for anything from well-child checks, where we're just kind of checking in, seeing how we're doing, kind of going over anticipatory guidance, vaccines, things like that, to sick visits as well. So, and other concerns that might arise along the way. So your pediatrician's not there just to, give vaccines and kind of talk about those things, but also they're invested in you. They want to know, what kind of things do you like about school? What do you do for fun? What kind of toys do you like to play with? And I think that's probably the most fun part about being a pediatrician, is getting to know patients, over so many years. So my philosophy of care is, to ask questions. I think it's really important for, parents to come prepared with questions for their pediatrician, but I also believe it's important for their child too as well. Whether it's questions about school or their body changing, I think it's really important for them to feel involved in their healthcare and, know that I'm an advocate for them and their health as well. As a pediatrician, I am most passionate about patient education. I think it's really important, not just for parents to understand about their child's care, but also for the child to be involved as well. Whether that's talking to a young child about, starting to brush their teeth on their own, or, an older adolescent about their college plans. I think it's really important to kind of keep children engaged, because eventually they're going to be taking care of their own health. So I like to start from a young age, making sure they're involved and kind of discussing their health from the very beginning. When I'm not seeing patients in the office, you can find me spending time with my husband, our daughter, and our dog, who's a dachshund. We enjoy going for walks outside, going to the zoo, trying new restaurants in the area, and kind of just spending time with the family. My biggest advice to patients is not being afraid to be a part of their medical care. I think it's really important for parents to come prepared to ask questions, but also children to kind of be curious and ask questions as well. I'm here to kind of advocate for the patients, and so I really want my patients to feel comfortable coming to me with any concerns they might have and being a part of their care.